There are 8 things you can do to live longer and fight aging, according to a new study. Scientists suggest that adhering to these 8 health measures could slow down the body's aging process by approximately 6 years. These measures include maintaining a healthy diet, engaging in regular physical activity, avoiding smoking, getting adequate sleep, keeping body weight, cholesterol, blood sugar, and blood pressure in check. Researchers analyzed data from over 6,500 adults with an average age of 47. They found that those with optimal cardiovascular health, as determined by these 8 factors, exhibited a biological age about 6 years younger than their chronological age. The concept of phenotypic, or biological age, was used to assess the participants' metabolism, organ function, and inflammation levels. This age is a comparison between one's biological and actual age, with a higher phenotypic age acceleration indicating faster biological aging. The study revealed that superior cardiovascular health is linked to slower biological aging. There was a noticeable dose-dependent relationship. As heart health improved, biological aging decreased. For instance, participants with good heart health had an average actual age of 41, but their biological age was around 36. In contrast, those with poor cardiovascular health were, on average, 53 years old, but had a biological age of 57. The study highlights the significance of healthy lifestyle habits in living a longer and healthier life. Women in the U.S. outlive men by 6 years. The life expectancy gap between men and women in the United States has reached its widest point since 1996, with men now living almost 6 years less than women on average. This disparity comes as the overall life expectancy for both genders has declined in recent years. In 2019, the average life expectancy was 78.8 years, but by 2021, it had dropped to 76.1 years. Researchers expressed concern over the decline in overall life expectancy and the disproportionate burden faced by men. While it is not surprising that women tend to outlive men, this trend has been narrowing in recent decades. However, a new analysis of death records spanning from 2010 to 2021 reveals a reversal that men are now dying 5.8 years earlier than women. Several factors contribute to this disparity. The COVID-19 pandemic has disproportionately affected men, leading to higher mortality rates among males. The second largest contributors are referred to as deaths of despair, encompassing alcohol abuse, suicide, and drug overdoses. Researchers suggest that cultural and social factors, such as stress, job loss, unstable housing, economic crisis, and reluctance to seek mental health care when needed, may aggravate these outcomes and contribute to the nation's mental health crisis. Men are advised to maintain a healthy lifestyle through regular exercise, a balanced diet, and avoiding excessive alcohol and tobacco use. Having a strong social support network, managing stress effectively, and seeking regular medical checkups and early detection of health issues can also contribute to a longer life.
Why do some people look younger than their actual age? A recent study found that individuals who appeared 5 years younger than their actual age exhibited improved cognitive abilities and were up to 25% less likely to suffer from age-related conditions such as cataracts, hearing loss, and osteoporosis. On the other hand, those who appeared older than their age had a higher risk of age-related illnesses. The study, which estimated participants' ages based on portraits, suggests that facial appearance is linked to both physical and cognitive health and could be used as an additional clinical marker. Other research groups have similarly found connections between youthful appearance and better underlying health. Factors contributing to a youthful appearance include sun protection, a nutrient-rich diet, regular exercise, adequate sleep, stress management, abstaining from smoking, and moderating alcohol consumption. Additionally, shorter telomeres, key pieces of DNA indicating cell replication ability, are linked to how young a person looks and are associated with various diseases. The study concludes that perceived age reflects internal aging, likely on a biological level, beyond the impact of lifestyle factors like UV exposure or smoking. While aging is inevitable, adopting science-backed habits can influence how you age, promoting a youthful appearance and better overall health.